Hello everyone. Let's just start. Okay. So what I'm going to do that I'm going to outline every single specific thing that are most important for this September exam. Now, anatomy is very important. Questions can be tricky, but you have to remember that whatever I told you in class from the first, those things will come in your exam in one way or another. And I have told you every version of question they can give you. So don't you worry about this at all. Don't worry at all. What you have to do, the things I'm going to tell you right now, you revise them again and again for the last couple of days. Okay. And choose the best option in your exam. But before that, one thing. Today, am I going to describe a lot of things? No, it will waste your time. Today, I'm going to outline what are the things that are most important. You have already studied all of this. If you missed some of these things, you revise that a little bit more. Okay, you revise that a little bit more. So don't worry about it. So from first, uh, what's the most important thing for your upcoming exam? See, this one, obstruction of the ventricles. Obstruction of the ventricles. Which ventricle is obstructed? So one, two, three, dilated. Which one is obstructed? Cerebral aqueduct. Simple as that. Simple as that. This question, the one I told you from at the first class. So a long time ago, I told you this. You might forget it. Just revise this. Okay. Then a question about hydrocephalus. Only that question. Hydrocephalus. Only that question. Nothing other than that. The question with the same stem with the same choices. Just that one. Obstructing, communicating hydrocephalus. The question about communicating hydrocephalus. Hydrocephalus. That one only. So two questions from here. Then second most important thing is the foramens. You will definitely have a question from foramen and you will have a question from foramen spinosum all the way I told you. All the way they twist and turn the questions I told you. All the way you will have questions from foramen spinosum. Others less important, not so important, but you must remember foramen spinosum. Even if you forget all of the other foramens, you should not and you will not. Don't worry about it. But you must remember foramen spinosum. Then, which foramen? Another two. Remember facial nerve, stylomastoid foramen, and chorda tympani branch of facial nerve, petrotympanic fissure. Okay, these two. Others just give a reading. Just give a reading. You will get it in your exam. But foramen spinosum, all the way, all the twists and turns I have told you in classes, remember those. Like a person got hit at the side of his head. Which artery can be injured? Of course, middle meningeal artery. So, middle meningeal artery is a branch of which artery? Of course, maxillary artery. Maxillary artery is a branch of which artery? Of course, external carotid artery. Simple as that. Okay. So remember these things. Then, and foramen ovale, you already know it. Can just give a reading. Foramen rotundum, of course, you know it. Remember maxillary nerve. Promax. Promax. And I had a candidate named Promax. The rest of it I will not tell you, but uh, she's good. And recently I just met her somewhere, and she said, "Are you Shihab bhai?" I said, "Yeah." And she said, "Yeah, I'm a student, a candidate, not student. Like she's a law senior anyway." So she is a candidate. So she said, "I'm the Pro Max one." Okay. Oh, I forgot. I remember. I remember the Pro Max one. Okay. So funny names in Telegram. No? Anyway. So other foramens, not so important. They don't ask much question, but you must remember superior orbital fissure. Superior orbital fissure. The easy one. Easy one. Superior orbital fissure, how easy? I told you, just write serially. You just write serially from 3. 3, 4, 5, 1. See, here is our 3, here is our 4, here is our, where is 5, 1? 3 branches from 5, 1. Frontal, nasociliary, lacrimal from 5, 1. Ophthalmic branch of trigeminal nerve. Ophthalmic branch of trigeminal. So 3, 4, 5, 1, and last one is 6 abducens. 3, 4, 5, 1 abducens. Then comes cavernous sinus. Same thing, just add V2 with it. Cavernous sinus 3, 4, 5, 1, 5, 2, 6. Anyway, simple and easy. Sympathetic ganglion, just one line, just this line. Stellate ganglion, anterior to transverse process of C7, C8, T1. This line. You must remember these lines. From optic nerve, remember it comes through optic canal. Simple. And with optic nerve, we have ophthalmic artery. Optic nerve, ophthalmic artery, we have from optic canal. Okay. So then, about visual pathway. About visual pathway. See, all you have to know by homonymous hemianopia. Homonymous hemianopia is very important for your exam. And where is the lesion? Where is the lesion? Remember, it's always optic tract or whole of the optic radiation. If they mention a single word from optic radiation, that a single loop, this loop, that loop, that will not be your answer. Never. Okay. So remember this, that optic nerve, optic tract, and optic radiation. From that optic tract and whole optic radiation. Okay. Then and this one, PITS, not so important. Just give a reading: parietal, inferior, temporal, superior. Okay. Superior homonymous quadrantopia, temporal tumor, and inferior homonymous quadrantopia, parietal tumor. Just remember these two, nothing else. And bitemporal tumor, not so important. Pituitary tumor, craniopharyngioma. If you know it, you can just give a reading. Not so important. Reading. Other things, these questions, no need right now, no need right now, no need right now. This thing, not needed right. Then this one, important. Give me a minute, guys. Why is it like this? Sorry, guys, give me a minute. So this one is very important. Which one causes constriction? Parasympathetic. Which one causes dilatation? Sympathetic. Simple. Just this line. And from here, nothing is important. From here, divergent squint, this thing, that thing, just forget it. Not important right now for your upcoming exam. No need to go through all of these things. For I just told you 3 things about what do I say? I just told you 3 things about muscles. Okay. 3 things about which muscle injury. Remember, for your exam, lateral rectus and superior oblique injury is important. How will those present? Lateral rectus will present with this kind of a picture if they give a picture. If they give a picture, this kind of a picture will be with lateral rectus. Okay. And superior oblique, this kind of a picture. Most of the time, they don't give a picture for superior oblique. They will just tell you that person cannot look downwards laterally during going down through stairs. Told you a lot of time, so I should not waste your time. You have just some days before the exam. So all you have to do now, all you have to do now is you revise all the things I tell you. So the faster I can go, the more time you will have for your revision. Okay. So from here, where's the nucleus? That's important. Where's the nucleus? Abducens nerve. Where's the nucleus? That's important. Okay. These things not important. Vertical, lateral, these will not important. Other clues I gave you, those will give you all the answers. So don't worry about it. This chart 100% important. 100% important. Remember all of the things mentioned here. Okay, so these questions, you don't need to go through these questions right now. Just go through our mocks questions. Just go through our mocks questions right now. Then from trigeminal nerve, guys, all three divisions, this chart, this chart, and this one. Where is the nucleus? Important. You have to study it. All these things here, not important right now. Not important. But remember the supplies. Tip of the nose, anterior ethmoidal branch, tip of the nose, external nasal branch of anterior ethmoidal nerve. Tip of the nose, remember, tip of the nose, external nasal branch of anterior ethmoidal nerve. Now, anterior ethmoidal most of the time is given in your exam. Okay? Anterior ethmoidal most of the time is given in your exam. Then, remember all the things I told you. Ala of the nose, infraorbital nerve. Okay, ala of the nose. This is the ala and ala of the nose, infraorbital nerve. Upper lip, labial branch of infraorbital nerve. Okay, all these things like from eye above, supplied by ophthalmic branch of trigeminal nerve. From eye below up to upper lip, supplied by maxillary branch of trigeminal nerve. Mostly infraorbital nerve coming out through infraorbital foramen. So if there's a sensation loss at cheek, he can have sensation loss at ala of nose too, lower palpebral conjunctiva too, and upper lip too. All these three things can get affected. Okay, remember from that area. So this is our infraorbital nerve. So ala of the nose can lose the sensation, upper lip can lose the sensation. Okay. So remember these things. Just remember these things. Simple. You will have these questions in your exam. And these two, like these two lines. So these two lines are important from this area. And of course, upper teeth, superior alveolar or superior dental nerve. Okay. Superior alveolar or superior dental nerve. Then let's come to mandibular division. This one too. Just these two lines. These two lines. And this line is very important. It is the nerve of first pharyngeal arch. Very, very important. They will give you first pharyngeal arch, muscles name, and one name from other area. And they will ask you which one is not supplied by mandibular division of trigeminal nerve, or which one is not derived from first pharyngeal arch. They can give this question too. So this is very important. This is very important. These things not important right now. This one, muscles of mastication. temporalis, masseter, medial, and lateral pterygoid. These four, remember these four. And others, they don't ask much about these questions, these, but remember muscles of mastication. Okay. So lower, all the thing about lower teeth, inferior alveolar nerve. Okay, inferior alveolar nerve comes out through mental foramen, which becomes mental nerve. This mental nerve supplies lower lip, like touch pain temperature sensation of your lower lip, touch pain temperature like lower lip, and depression of the mouth, depression of the mouth. This one is done by, so depression. Remember it. It's related to marginal mandibular nerve. Okay, we have this question, but sensation, touch, pain, temperature is supplied by this mental nerve. So lower lip, if someone kisses you and you don't sense it, so which nerve is gone? Okay, so your trigeminal nerve is gone. But if someone tries to kiss you, but your lower lip doesn't go down, so what happens? This is the marginal mandibular nerve is the problem. So facial nerve is the problem. Okay, so this is the easiest way to explain anyway, that you should not forget the motor, you should not forget the sensory. Sensation is a different thing, motor is a different thing. So you just mix these things up a lot of times. So please don't do that. Please, you mistake these questions. Like if your question is your smile is uneven, smile is uneven, so that's not related to trigeminal nerve at all. I really get angry when you make mistake with this kind of questions, and a lot of people do that. When your smile is defected, that's not something related to sensation. So why would you why would you select trigeminal nerve? No, you don't. It's related to motor, it's related to motor, it's an action. So zygomatic or buccal muscles, these are not working. We have it later on. I'm showing you. These are not working. So uneven smile is a cause of facial nerve injury, a defect in a facial nerve, not trigeminal. So what are the things important? See these pictures. You will have a lot of questions from this picture. Maybe 2-3 questions you will have it from here. Remember angle of jaw. This is angle of jaw. This is angle of mouth. Don't be a fool. This is angle of mouth. This is angle of jaw. Okay, so this is supplied by greater auricular nerve. This lower half, including tragus, supplied by greater auricular nerve. This parotid gland, parasympathetic. All these things are important. Parasympathetic supply is by glossopharyngeal nerve before ganglion. Which ganglion? Otic ganglion. And after otic ganglion, it's taken by this nerve, auriculotemporal nerve. Auriculotemporal. Simple. Behind ear, here we have lesser occipital nerve. Simple. This area, every year they give questions about this area. Don't make a mistake with this area. Don't. Very easy. Just watch my classes and you will see everything I have described previously. Every single thing. So this area is important. And then again, here is our chart of detailed everything. Detailed everything. See, guys, I sometimes I get, I feel like I don't know. I feel sometimes I feel really, what do I say it? Like posterior surface of ear and behind ear is not the same thing. Not the same thing. So behind ear, lesser occipital, posterior surface of the ear, or medial surface of the ear. This is the medial surface. Medial surface is there. Upper part lesser occipital, lower part great auricular nerve. Okay, remember this. And this one not important. Still, you can, if you want, you can remember it. Remember tragus. This one tragus. supplied by greater auricular nerve. This earlobe supplied by greater auricular nerve. So if I wear an earring like Cristiano Ronaldo, that diamond ring, that beautiful one, I really like that, and I feel pain, that means my greater auricular nerve is responsible for that. Okay. Then lesions of trigeminal nerve worth remembering, but before exam, right now, you don't need that. You don't need that. You don't need that. But remember corneal reflex, the one I told you. Which one is the afferent? Which one is the efferent? Question goes to you guys who are doing the class. Afferent limb, efferent limb. Like usually I don't ask questions, but I feel a deep urge to ask you people questions tonight. Okay, so I'm going to give you a chance to unmute yourself and answer me which one will supply the afferent limb of corneal reflex and which one will supply the efferent limb of corneal reflex. Tell me who can? Anyone? Dr. Orko?
Efferent হচ্ছে facial nerve
Okay.
and
And
afferent by vagus.
great. Awesome. For the answer, yes, efferent is exit, afferent is incoming. Okay, so afferent is incoming. So afferent is coming from trigeminal nerve, and efferent is from facial. Okay, that means if you touch your cornea, the sensation will be carried by nasociliary branch of ophthalmic division of trigeminal nerve. And when it goes to
ভাইয়া
brain,
মিউট হয়ে গেছেন আপনি।
brain, uh-huh, মিউট হয়ে গেছে নাকি? Okay, thank you. আমি কিভাবে মিউট হয়ে গেলাম? Okay, guys, thank you. আমি আবার I'm starting again. Okay, so when you touch the cornea, what will happen? When you touch the cornea, the sensation will be carried by nasociliary branch of ophthalmic division of, this is very important, that's why I'm explaining it a little bit. Ophthalmic division of trigeminal nerve, and it will go to brain, and from brain the impulse will exit, that is E for exit, E for efferent. The efferent arc will come out through facial nerve, and which branch? First two, temporal and zygomatic, both temporal and zygomatic, both these two supply orbicularis oculi. Remember oculi, people. Remember one thing, guys. When you go to exam, you are so stressed that you are confused about orbicularis oculi and orbicularis oris. Keep your head calm, so you can get missed with it. Like what came? I give you an example. There was a question in last January diet that they asked which one is a sign of base of the skull fracture. There, they gave one option, periorbital edema. But I told you in class that periorbital blackish discoloration, not periorbital edema. And you people made mistakes. A lot of people made mistake with this question. Like people passed still, but they made a mistake with this question. But this is so beautiful, you know. Like I told you, periorbital blackish discoloration, not edema. Like in exam, we stay so stressed that we can miss these things. Periorbital edema is a sign of glomerulonephritis. It's not a sign of base of the skull fracture. Periorbital, like your around your eyes, everything will be black, like Kung Fu Panda.
Okay, guys, like if you have seen Kung Fu Panda, so this is called raccoon eye or panda eye, and your blackish discoloration over mastoid process behind ear, mastoid process. These are the signs of base of the skull fracture. Base of the skull fracture. A bonus question. You can have this question. Periorbital blackish discoloration or bluish. Number two, CSF rhinorrhea. Okay. Number three, blackish discoloration over mastoid process. Every single thing is important, guys. Everything has a possibility, and most of the things you will see, most of the things will come in your exam. Now, thing is that what do I do? How do we test facial nerve? We know, like we tell people that you close your eyes tightly, that we can't open it. What we are testing in that, we are just testing that orbicularis oculi, which is supplied by temporal branch and zygomatic branch of facial nerve. Facial nerve. Another thing, I'm talking about all the mistakes you make in these questions. Another thing, they tell you there's a fracture, there's an injury at your cheek, at a person's cheek, and he's feeling numb. He's feeling numb. Which nerve is injured? Of course, just a while ago I told you that infra orbital nerve is injured. But here's a twist. They give you zygomatic branch of facial nerve, and a lot of people select that. Don't do that. Don't do that. Zygomatic branch is a motor branch. It has nothing to deal with numbness or sensation. Numbness is when you can't feel touch. That's numbness. Okay. So you can't feel touch. That's related to trigeminal nerve. That is infraorbital branch of maxillary division of trigeminal nerve. Simple, right? So keep these things in mind. Then facial nerve. All these things not important at all right now. Not important. But this thing I told you, this is a gem, guys. This is a gem. The way I told you, you will have questions from here all your life. All your life. Where and how do I know it? If you give part B, of course, you will have questions from here. If you give licensing exam for Singapore, you will have questions from here. If you give licensing exam for Australia, you will have questions from here. Like, we don't know what life brings, right? We don't know which thing we might have to give a lot of exams in our life. And lastly, but not least, FRCS. How do I know it? I have nothing to do. Guys, I have nothing to do. What do I do? I just see questions from all over the world. So I have seen that they use this thing in a lot of places. A lot of places. And this will help you a lot. This will help you a lot. Remember all these nucleus names, salivatory and lacrimatory nucleus. Just add superior here. Superior salivary and USMLE. I forgot to tell you, USMLE. You have questions from here. In USMLE too. From these four, like I don't know why everyone loves facial nerves so much. Like every continent, beyond barriers, they just love facial nerve. Now, superior salivatory and lacrimatory nucleus, they give your two fibers, lacrimatory fibers and salivatory fibers. Of course, you know, just watch that portion from neuroanatomy class. This will help a lot. Okay. So if I go to describe all of these things, we have a lot of things ahead. We will not be able to complete it. So I will tell you this one is very important. Remember all the names, and remember test fibers comes from nucleus of Tractus solitarius. Okay. So these things will come. Okay, just let me describe in short. Okay, in one line, what you can do, you will have a paper and a pen in your exam. Okay, if you feel confused or if you think that I cannot remember, what you can do, you can draw a line, simple line. Here is the brain. Here is the brain, and here is geniculate ganglion, and here is your stylomastoid foramen. Remember this. So then, brain, geniculate ganglion. From geniculate ganglion, like let's say before geniculate ganglion, lacrimatory fibers. Remember lacrimation. After geniculate ganglion, inside middle ear cavity, inside middle ear cavity. Okay, that enters. Oh, where does it enter? From it enters from your enters through your petrous part of temporal bone, petrous part of temporal bone through internal acoustic meatus. Okay, so it will enter your petrous part of temporal bone through internal acoustic meatus. They ask you this question. Okay, so before entering, like at geniculate ganglion, it will give lacrimatory fibers. Okay, remember the name from previous discussion. Okay, like let's just say it. Okay, so greater petrosal nerve. Then from greater petrosal nerve, we go to pterygopalatine ganglion. Pterygopalatine. Then from pterygopalatine ganglion, we give fibers to our lacrimation glands, lacrimal glands, and your nasal mucosa, right? Nasal mucosa. And tear comes and nasal secretion comes when you cry. Okay, Terry, don't go. Terry, go. So we cry. Okay, so inside internal ear or middle ear cavity, first branch is nerve to stapedius. Nerve to stapedius, which will stabilize the stapes. We know it. And if that's injured, that fiber is injured, we get hyperacusis. Hyperacusis. So you listen a lot, you listen more, you have greater sensitivity to sound. Simple. Then what? Then through petrotympanic fissure comes out two nerves. We know it. Two nerves. One is chorda tympani branch of facial nerve and our salivatory fibers. Salivatory fibers. They will go along with lingual nerve at your anterior two-third of the tongue. Your lingual nerve will supply touch, pain, and temperature. Chorda tympani will supply taste, and the our salivary fibers will supply to our mandibular ganglion, submandibular ganglion. From submandibular ganglion, we will have two supply: submandibular gland, sublingual gland. Simple. And after stylomastoid foramen, what do we have? I have told you this in question discussion too, because this is very important. Very important. It's worth mentioning. Okay. So, uh, and after that, all our motor branches, temporal, zygomatic, buccal, marginal mandibular, cervical. Okay. So, which nerve can get injured during sublingual, not sublingual, let's say submandibular gland excision? This one, marginal mandibular. What are the questions associated with it? This one, submandibular gland excision. Which nerve can get injured? Of course, marginal mandibular nerve can get injured. Like you are, you. That's why you have to go 1 or 2 centimeter down to enter this area. So then, uneven smile caused by C. If your lips can't go up like this, can't go up, they will give you scenario. Don't worry about it. You will understand. So that means your zygomatic and buccal both can be defected, or any one from this will be in your stem. And if they say that one area is depressed, Okay, or you cannot depress your angle of mouth. Angle of mouth. You cannot depress your angle of mouth. You can't do that. So marginal mandibular nerve will be injured. Will be the answer. Simple. And this and what are the these are the questions from motor branch only. And other questions. What are the other questions? Injury. Let's say injury is after geniculate ganglion. After geniculate ganglion, lacrimation will be preserved. Injury is after stylomastoid foramen. All of these will be preserved. Okay. So injury is after geniculate ganglion. That means distal to geniculate ganglion, the appropriate word. So you will have hyperacusis, you will lose touch pain temperature, you will lose taste, you will lose salivation, you will have dry mouth, but you will have lacrimation intact. Intact. So you draw this line and give this give this landmark and just write hyperacusis, just write temperature, just like not temperature, guys. Temperature is related to trigeminal, so uh, we just leave it here. So we are just talking about facial nerve. So taste will be gone, dry mouth will be there. Okay, so here is the chart. Here is the chart, guys. This one, guys. This picture I just told you that just to see these nucleus names. Okay, just to see. Don't believe Google with all of things because they did not elaborate it. Skin of the posterior aspect of external auditory canal. Guys, external auditory canal, just if this is our inner ear and here is our ear. Okay, if this is your middle ear, here is the tympanic membrane. So in this external auditory canal, only this little area, very minimal area is supplied by facial nerve. Facial nerve which is above temporomandibular joint. Okay, so this one has to be specified. Okay, if they specifically mention a small area at posterior aspect of external auditory canal, like inside your external auditory canal and posterior aspect, a little area, I have given you the picture, maybe in the recall. So you study that, okay, guys, you will get confused otherwise. Remember, where are the nucleus? Okay, where are the nucleus? Remember, just see this. Okay, just see this. Remember this one. All the names, you must know all the names: temporozygomatic, buccal, marginal mandibular. Then these two lines, very important, very important. This one not important. And this one is 100% important. Draw this one line and write lacrimation here, hyperacusis here, taste, salivation here, stylomastoid foramen, facial expression here. So they will give you a question that injury distal to genicular ganglion. So you give a cross here, and after the cross, everything is lost. Before the cross, everything is preserved. So just draw this picture and just give the cross. You will not need much time if you have done classes. And here we have given you all the scenarios. You can give a reading. Then from this page only this line that how do you differentiate between upper motor neuron and lower motor neuron lesion? Remember, raise eyebrows. Eyebrows goes up, it means upper motor neuron lesion. Eyebrow goes up, upper motor neuron lesion. Understand, remember all of it. 100%, remember it. All of the things I have told you, I have written it down here. So remember all of this. Then auditory vestibulocochlear nerve, not so important. You can just skip it. Glossopharyngeal nerve. What are the questions I told you? Glossopharyngeal nerve. Remember this one. Parasympathetic, preganglionic parasympathetic fibers is done by given by glossopharyngeal nerve. Okay, and special sensory taste posterior one third of the tongue. Taste, touch, pain, temperature, all supplied by glossopharyngeal nerve. Okay, all supplied by glossopharyngeal nerve. Remember the name, glossopharyngeal. So your pharynx, your tonsils, all these things are supplied by glossopharyngeal nerve. Okay. Remember gag reflex, very important. Remember gag reflex, very important. Efferent limb through vagus, afferent, afferent through, afferent through GP, glossopharyngeal. Okay, afferent through GP, efferent through vagus. Then comes all these things, guys, not important. Will not have a questions from here. Not important. If you have studied previously, good, good. This will give you confidence. This will give you make your decision making easier. But for straight cut questions right now, no. For the last moment, you just revise the things I am telling you. Okay. So this is our otic ganglion. This is our otic ganglion. Glossopharyngeal nerve will give preganglionic parasympathetic fiber, and its nucleus is in medulla. Okay. Preganglionic parasympathetic fibers, and those fibers will come to otic ganglion, and auriculotemporal nerve will give postganglionic parasympathetic fiber. Those will go to parotid gland. Then vagus. Right now, not important at all. Not important at all. Not important at all. Not important. Not important. Not important. Remember this line. I have told you several times. Still, you make a mistake with this. Don't do that, guys. You will. It's a costly exam, guys. Remember just this line. Remember just this line and gag reflex. Okay, gag reflex and injury. 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 Thyroid injury. Thyroid OT. Then injury. All the questions I give you in mocks. Okay, this is 100% important. So stylopharyngeus is innervated by glossopharyngeal nerve. Just remember this, and all of the muscles supplied by vagus. So remember one specific question about Raynaud pain. Supraglottic cancer, pain in ear, vagus. We have a beautiful photo in our flashcards. You will have all of the referred pain list there. Supraglottic cancer. Then pain from teeth to ear. So this is supplied by trigeminal nerve. Pain from tonsil to ear. This has carried by GP, glossopharyngeal. Simple, easy, and beautiful three questions. Parasympathetic function right now not important at all. Hypoglossal nerve is important about tongue deviation. Remember the questions about tongue deviation. Remember genioglossus. All of the here we have the line extrinsic muscles. All of the extrinsic and intrinsic muscles of tongue supplied by hypoglossal nerve, except palatoglossus, which is supplied by vagus. Simple, but that's not important. Remember hypoglossal nerve. They will give you questions related to or attached to a surgical scenario. Now, what is a surgical scenario? The scenario would be the person has had carotid end arterectomy. Carotid end arterectomy. Right now, what's the first thing surgeon will be checking next day? Tongue deviation. Surgeon will ask, can you put your tongue out? Okay. So can you put your tongue out? So our tongue main bulk is done by genioglossus. Main bulk of the tongue is formed by genioglossus. Genioglossus pushes the tongue forward during protrusion of the tongue. So if hypoglossal nerve is injured on right side, this right side will be paralyzed and tongue will be deviated to right side, which we call that ipsilateral deviation of the tongue. Simple. So you must know these things. And remember, carotid end arterectomy. Which one is the most commonly injured nerve? Hypoglossal nerve. And of course, Vegas can get injured and glossopharyngeal a little bit upwards, but still can get injured. Answer cervical is not important right now. Spinal accessory nerve, remember, winging of the scapula. Remember three things I tell you. Winging of the scapula. Winging of the scapula. So posterior triangle, any posterior triangle procedure, any posterior triangle procedure. So what is injured? Accessory nerve, axillary procedure, or axillary lymph node clearance. Remember, salt. Okay. Serratus anterior, long thoracic, long thoracic. Okay. Simple. These two. And another thing. Okay, we will show you later on. Just remember these two. Then blood supply of the brain. Remember stroke. Remember stroke. Just see, remember, this is a surgical exam, guys. They don't expect you that you answer questions like MRCP, right? They don't. They will not give you vague scenarios about stroke. They are not going to do that because you don't have that job. When you go to work and you see something, you just refer to medicine. Simple as that. You don't have to deal with those things. Don't forget it. You do your thing best. You do your thing best. So for that, how much you need to know? These two. If they mention leg is paralyzed, leg is involved, leg is more weak. Legs are the main concern. Anterior cerebral artery. Hands or aphasia, middle cerebral artery. Simple as that. Vision loss. Complicate things. Don't complicate things. You have a long stem, you have a big stem, but the main thing here is your hands are weak or the person cannot talk, articulate sentences properly. Like instead of saying I eat rice, they say that I rice eat. So this is in English. Like we have one like Turkish professor with us. Like I learned a little bit of Turkish recently. So I just know that Ben Sooth HR. I drink milk. And what do you do? That person will not be able to say Ben Sooth HR. He will say that Ben HR Sooth. He cannot articulate sentence properly. That means middle cerebral artery is injured. Middle cerebral artery is injured. Okay. So then these things, you must remember these things, and only this will work. No matter how long the stem is, no matter how big the stem is, you will get this scenario. If you summarize, you will see only legs are the main concern. So anterocerebral artery is injured. Simple. Which stroke? Anterocerebral artery stroke. Hands are not working or hands are more weak than legs. Middle cerebral artery is middle cerebral artery stroke. Simple as that. So only these questions you will have from stroke. Again, let's say homonymous hemianopia. HH, you have homonymous hemianopia. Now, do you think homonymous hemianopia, only homonymous hemianopia is the problem. So posterior cerebral artery is injured. But if they say that with homonymous hemianopia, articulation is lost too. Articulation is lost. That means if that person is have or aphasia or hands weak. Remember, middle cerebral artery stroke. Because we have, what did I tell you? That optic radiation, optic tract, optic radiation, those are going through our parietal and temporal lobe, both. And these are supplied by middle cerebral artery. But final, finally it goes to visual center, which is in occipital lobe, right? But so that means, in simple, if you have aphasia with vision loss or homonymous hemianopia, MCS stroke. But if only homonymous hemianopia, posterior cerebral artery stroke. Simple. So about internal carotid artery branches, this line, first branch after coming out through cavernous sinus, ophthalmic artery. Just remember this one. Remember in neck, no branches. These things, segment 1, 2, 3, 4, forget it. Not important at all. Remember continuation, middle cerebral artery, branch, anterior cerebral artery. Remember anterior circulation and posterior circulation is connected by posterior communicating artery. Just this piece of information, posterior communicating artery. Then here we have a detail. You don't need detail right now. Just give a reading. Just give a reading. You can study this one, posterior infocerebellar artery infarct, and they give these scenarios mostly. That's why I collected it here. Then this one, which nerve will be affected first? In an anterior inferior cerebellar artery infarct, there's a correction. Abducens will be infected first. Okay, abducens. Which one forms the posterolateral boundary of posterior communicating artery? This one. This one. Just remember it. Okay, guys. Then cavernous sinus, 100% important. Remember the contents, and if there's cavernous sinus thrombosis, which nerve will be affected? Number one, first nerve to be affected is abducens because it's very close to internal carotid artery. This one, first nerve to get affected. It's inside cavernous sinus, and others are on lateral wall. That's why abducens is most commonly, and mostly they will give you all of the choices. Abducens will be the answer because others are on lateral wall. They don't get damaged much. Remember these three lines from dural venous sinus. Only these three lines. Only these three lines. Spinal nerve, remember where it ends. Remember where it ends. This is conus medullaris. This is conus medullaris. Usually ends at L1 in adults. L1 in adults. In child, L3. See, it can end in L2 in adult too. Okay, so there is a range. This is the most commonly found level. Okay, this is most commonly found. So L1 is the most common in adults. That doesn't mean if L1 is not an option, go for closest one, L2. Simple as that. That will be the answer. Then dural sac will end at S1 in case of adult. S1. In case of child, it varies. S2, S3 both, but S2 is more common. So you choose, if you have both options, you choose the more common one. So go for S2. But if you don't have S2 in your option, of course you go for S3. Simple. So that's how you get confused in the exam because they give you other options too. They give you variation options too. That's a variant that can happen. So they gave you that option, and you give the exam, and you come back and you tell me that but this should be this. But no, this like nothing in this world happens like this. That this should be this. No, it doesn't happen in real life. It's full of surprises. Okay, it's full of surprises. So don't get surprised. I have told you all the possibilities. So you will have questions just like that. Now, remember, lumbar puncture is very important. The toughest layer is ligamentum flavum. Okay, we have it right now. And after that, we have extradural venous plexus. Any bleeding, we have it later on. I will show you. Okay, any bleeding happens from venous plexus. Okay, and remember this thing. Of course, remember nucleus pulposus, annulus fibrosus. Annulus fibrosus is deficient. Nucleus pulposus is derived from notochord, and it gets nucleus pulposus gets prolapsed. Simple. Then this one, denticulate ligament. Just remember denticulate ligament that holds the spinal cord with inside dura. Okay, guys, let's go to head neck. What will you study from head neck? Guys, see, in the last moment, you don't need to go for any boundaries, nothing, no boundaries. They will not ask you these questions. Not important, not important, not important, not important. Guys, just remember injury to accessory nerve. Okay, not important, not important. Retros, no. Give a reading. Metastasis. If you have supraclavicular lymph node enlarged, two questions from here. Which organ will you check first? If that's a male, testis. If that's not a male or testis is okay, it's gastric carcinoma. Okay, it's gastric carcinoma. Simple. Just remember these two lines. Then carotid sheath is 100% important. All of the things, all of the questions mentioned here, carotid sheath, all of the questions you remember that. All of the questions remember that. Then tonsil, not important. Your measurements not important at all. Not important. You know glossopharyngeal nerve. Remember this box. 100% important. 100% important. Remember this box. Then here we don't have anything. Welder's ring important. People have questions from here. They give questions from here. This is 100% important. And of course, papilla is not important at all. Forget papilla for now. Tongue. This chart is important and lymph drainage. This chart is important. 100% and lymph drainage, of course. Lymph drainage. This lymph drainage is important. This chart. You must remember this chart. Don't go to exam hall without remembering this chart. Don't. You will have questions from here. Then larynx. Remember that question I told you? That cricoid cartilage is round, others are C-shaped. Behind we have a membrane and behind we have esophagus. So if we have an esophageal tumor, it will compress from behind and we will have respiratory problem. Respiratory problem. But if at the level of cricoid, that is C6, we have a tumor on esophagus, it cannot compress the trachea because this cartilage is round. Only this one is round. So what will happen? We will not have any respiratory compromise. No respiratory compromise. Okay, here these you can just skip it. Just remember narrowest part name, rima glottitis. Okay, muscles of the larynx you remember, muscles of the larynx name and action. This is important, 100%. Name and action. Then artery supply, give a reading, not important much. Now lymph drainage, just this line, not this one. This one is not important. This one, these lines are important. Remember these lines. Then nerve supply. Of course, you must remember that you will have questions from here, from ligation of superior thyroid artery. Okay, so from ligation of superior thyroid artery, you will have questions just the way I described in class. You remember that. Remember external, internal, and internal laryngeal nerve has two branches. The superior laryngeal nerve has two branches, internal laryngeal and external laryngeal. External laryngeal will innervate only cricothyroid, and person will lose high pitched sound and cannot sing high notes. Inferior or recurrent laryngeal nerve, of course, unilateral injury, you will have gargling sound, dysphagia. Okay. And of course, unrecognizable voice, hoarse voice. Okay. Bilateral injury, of course, all muscles are paralyzed, and of course, you can have respiratory compromise too. Respiratory compromise, that's not so important for part one. Okay. So you just remember this one. Then thyroid gland. Thyroid gland. Remember tracheostomy. In tracheostomy, what do we pierce? Isthmus. We pierce the isthmus. Why do we give emergency tracheostomy? We do in emergency. What do? We pierce cricothyroid membrane. If this is cricothyroid, we will pierce cricothyroid membrane. Okay, cricoid cartilage, and in between thyroid cartilage and cricoid cartilage, we pierce the cricothyroid membrane. Okay, now site of tracheostomy. What is the usual site? Usual site. Site is very important. Usual site. We have it later on. Let's say we have it later on. Okay, artery, 100% important. Superior thyroid artery, first branch of external carotid artery. You must remember that. Inferior thyroid artery, branch of thyrocervical trunk. Second branch of subclavian. You must remember that. Superior middle thyroid vein, not important. Veins are not important. Relations are right now not important. Isthmus, remember 234. Then this one, tracheostomy. So the usual site is midway between sternal notch and cricoid. If that's not in our option, remember thyroid. See the level 2, 3, 4. Three cartilages 2, 3, 4. So if from thyroid cartilage we have it here, so from cricoid cartilage we will have it here. So we can do it in both places. So both are right. Don't make me mad anymore. I will not answer again. Okay, so if that's not present, thyroid cartilage not a problem. In emergency, what do? We pierce cricothyroid membrane. We pierce cricothyroid membrane. We do cricothyroidotomy. That is 1 centimeter below thyroid cartilage. Approximately. Okay. Like this is standard. What do you mean by standard? That means we can do it here too. We can do it here too. Okay, guys, we can do it here too. So this is 100% important, and it reduces work of breathing and anatomical dead space. This in all these four lines. 100% important. You must remember these lines. They will give you this question. Then parathyroid, embryological origin, blood supply, relations not important. Parotid gland, just this one, and why Frey syndrome happens, or gustatory sweating. Remember this line. Regeneration of parasympathetic fibers. Which one? Postganglionic parasympathetic fibers.
into sympathetic. Remember this line. Regeneration you will have. If you have this question, you will have the same thing with the same words. Okay. Then salivary duct. You must know why does it open. This one, 100% important. Then structures passing. You must remember all of the structures. Facial nerve, external carotid artery, retromandibular vein, auriculotemporal nerve. See, here I have told you that here it supplies parotid gland at angle of jaw. Parotid gland, and this is the reason we don't keep our books outside the courses, because these things are, we just wanted to save money, so we used few letters. Okay, and we can just write it that supplies the parasympathetic supply of parotid gland at the angle of jaw. Don't be a fool. Don't miss a class. Another thing, we did these kind of things in a lot of places because you have to do the class. If you don't do the class, only study the book, you will not pass this exam. And you will blame my book, and I have nothing to do with it. Okay. I will not do anything about it. You must do the class, because if you don't do the class, you will not understand a lot of things. You will think I will just study these things and I will pass. No, you can't. Everyone studies the same book. Like what did happen? Like you like all those people who got a chance in medical colleges in Bangladesh, India, or Pakistan, they hold exams, right? They all read the same book, right? They all read the same book. Still, a lot of people didn't get the chance, and a lot of people did get the chance. So books are same, topics are same. What's the difference? It's the way. It's the way you study. You should study smarter, because life, we have a lot of things in our life. We have a family. Some of us, we have boyfriends, girlfriends, we have our child, we have our mom, dad. We need to spend time with them too. Like you spend all day studying, and you don't do anything. That's if you love that, that's not a problem. But there are a lot of things to do now. So what do? You study smart and just do what works, and you will see that 50% your work is less, or 50% of your work has reduced if you do it in a smart way. So that's why you see the classes. So relations of parotid gland, not important. Artery, vein, right now not important, but nerve is important. Remember this. And drainage is important. Nerve is important, drainage is important. Remember the nerve, remember the drainage. Then submandibular gland. Submandibular gland, remember 75% of the saliva is secreted by submandibular gland. Very important. Relations not important now. Submandibular duct. Name is important. Name is very important. And they will ask you this question. Remember this line. Remember this line. This line is important. Name 100% important. This line 100% important. These things not important. Drainage is important. So if they say that, they specifically mention that they you have dilatation of deep cervical lymph nodes. So where did the carcinoma came from? What's the most common thing? What's the most common? Lingual, lingual, not lingual nerve. I mean, I'm saying that tongue. So tongue. So tongue is the most common carcinoma I have seen. Have you ever seen in your life nasopharyngeal carcinoma? I haven't seen one patient. Maybe my life is very short. I'm a young guy. Not that young. I'm old. My hairs are white. My beard are turning white too. So like this short lifespan, I have never seen a person with nasopharyngeal carcinoma, but I have seen a lot of people with tongue carcinoma. So which one is more common? Go for the common things first. Sympathetic, parasympathetic. Remember this. Questions right now, not important. Just remember number one. Not important, guys. Not important. Anatomy of the face, not important right now. Just remember pterion. What are the bones that form pterion? Remember frontal, parietal, squamous part of temporal, and greater wing of sphenoid. Greater wing of sphenoid. Okay. These four. Here we have nothing much important. Important arteries of your head and neck, not important right now. Internal carotid artery, just like the previous one, just this box. Just outline some important things in this box. Important branches, just remember no branches at neck and after emerging from cavernous sinus, ophthalmic artery is the first branch. No branches in neck. External carotid artery. Three in front. This is very important. Three in front, two behind, and one deep. Okay, three in front. Superior thyroid, that's the first branch. Lingual, facial. Behind, occipital, posterior auricular. Okay, and ascending pharyngeal. Okay, so here we have maxillary artery and superficial temporal artery. So this maxillary artery will give you middle meningeal artery. Okay. Carotid end arterectomy. So here we have carotid body. Okay. Here we have at the low at the starting of internal carotid artery, we have carotid sinus. Carotid sinus. Remember, carotid sinus is a baroreceptor, which is a baro means stretch receptor. So baroreceptor, B for baro, B for BP, it will sense a drop in your BP. Aortic body, I mean carotid body, sorry guys. Carotid body. Carotid body is mostly sensitive to oxygen and it will sense a drop in oxygen in blood. Okay. So both will go to your cardiorespiratory center in medulla. Through which? Through glossopharyngeal nerve from here. Okay, remember this. So cardiorespiratory center is in medulla and glossopharyngeal nerve nucleus is also in medulla. Remember this piece of information. This will help. Okay. And here we have hypoglossal nerve closely, very close. So if we do a carotid end arterectomy here, hypoglossal nerve is the first one to get injured. Simple. Scalp blood supply during fixation of screw, 100% important. You remember this question. Then subclavian artery. Remember all the branches of subclavian artery, but mostly remember vertebral artery. Vertebral artery will enter through C6, go up, arch around your atlas, and as enter your skull through foramen magnum. Enter your skull through foramen magnum, and two vertebral artery will join in front of medulla and become basilar artery in front of pons, and at the end of pons it will give to posterior cerebral artery. This is the posterior circulation of brain. Simple. Comes from vertebral artery, which is a branch of thyrocervical trunk from subclavian artery, which is a branch of thyrocervical trunk from subclavian artery. Very important. Okay. Outer vertebral fascia. Remember this line. Remember this line. And subclavian artery. Here we have all the parts. Here we have all the parts. So remember all the parts. 100%. This will help you a lot in answering a lot of questions. Subclavian steal syndrome. Give a reading. This one, give a reading. Then we have cervical. This one also give a reading. If you want, you can rewatch the portion from previous classes. And of course, pharyngeal apparatus is 100% important. 100% important. Okay. arch, of course, you have to remember it, but mostly they give you question from fourth arch and sixth arch. Okay. And from pouch, they give you question from mostly third pharyngeal pouch. This is the most commonly given. It doesn't mean they will not give from other areas. They can, but this is the most commonly given thing. So head neck is done. Only these things from head neck. Well, I am finishing the class now. I will record the rest of it and I will upload about upper limb and thorax. Okay, guys. Thank you for your time and give revision. Revise again, again, and again, and you will. Okay, guys. Let me see. What are your queries? Yes, nice, great. Thank you, Dr. Emil Kanbe. Emil Chanbe. She's from our Turkey. She's from Turkey. And thanks a lot for your time. And I'm signing off. I will upload the rest of it about upper limb and others just within tomorrow. Okay. Thank you. Have a good night.